You all's new realm is function.
Right.
They've taken it away from the therapist. Because to get functional outcomes, we need time. We're being cut back to where we're almost now acute and early subacute. Once they get to subacute, they're moving them out of the clinics. Yeah. Your realm now becomes function. It's not just some exercise. What exercise do I need to do to get them to a certain level of function? Which takes us to this, medical exercise training. What are the next steps? The next steps are, we know insurance carriers are going to start saying, hey, Mr. Smith or this young lady, let's say her name is Mrs. Jenkins. Mm-hmm. Mrs. Jenkins, your insurance company will pay for this, okay? Insurance company says, hey, we'll reimburse you $80 a session. You charge $100, we'll pay you $80, she'll pay you the other $20. Is she going to come more often?
Oh, yeah.
Are you going to get more clients?
Yep.
Oh, yeah, and suddenly everybody's like, well, this is good. I can deal with the insurance. And they cut you a check or they deposit that money in your account, and suddenly you wake up one morning, it's like, woo, this is not bad. And I got the other $20 from the client. So our next steps we wanted to talk about here, and we purposely asked Justin to come in with this client. Our next steps now are, you guys have to manage this client. You have to produce an outcome for this client. So the question now becomes, how long, how often, how much? How many sessions do you think you needed to see this lady for? So she comes in the first time. You sit down with her. Now, let's not say her. Let's say you have a similar client that comes in a year from now.
Okay.
Comes in, very similar situation, not exactly the same.
All right.
How many sessions do you think you need to see her to get her back to where she was? Or get her functional again? How many sessions?
3 times a week for 3 months.
Okay. So 3 times a week for 3 months, that's how many weeks? That's 36 sessions. Okay, 36 sessions. Question, insurance carrier gonna pay for the 36 sessions? They already cut PT. 36 sessions? Nah, they gonna pay for 36. Could we cut that down to say 12? Yeah, we cut it down to 12.
Okay.
So here's the deal. You now have to work smarter, not necessarily faster, smarter. You now have to make sure they're doing their homework. And you now have to always remember there's somebody else back there that's doing what? Looking over my shoulder. How many sessions is that? And they're also asking you, hey, what assessment did you do? Because if that report comes in where you charged $150 for that assessment and they wrote you a check for $150, 2 weeks later, they send you an email that says, hey, we need to have your assessment also. And that assessment says, if we were looking at yours, and I'm not trying to put you on the spot, that first assessment you did on her, there'd be a lot of blank spaces on it, wouldn't it?
Oh, yeah.
Yeah. And they would have said, really? Yeah. $150? Red flag. Yeah. Okay, we're going to put that one over here on this side of the desk. And then we're going to send you a letter that says, hey, we want our $150 back. We paid it to you, but we want it back. Now, I don't know if any of you ever dealt with the IRS. The worst collection agency on the planet is not the IRS. It's an insurance company. Because they'll say, you know what? Not a problem. We'll never pay you again until we get our money back. So any other clients that you see that are on our plan, okay, you might see them, you owe us $150. We're going to reimburse you $50 for that one. We're going to keep that. Yeah. Oh, the next $150, we're going to keep that until you get to the point you've paid off the balance. Right. That's how they're going to do. And you're going to get pissed off. You and Jason and Darwin are going to get the other. We're going to get a lawyer and sue the insurance company. You're going to go down there with your 2 or 3 lawyers. The insurance carrier going to roll in there with 36 lawyers.
I can't afford 2 or 3 lawyers. So
yeah, there you go. So learn to play fair with them now. And I know a lot of you don't want to hear this, but that's why we're doing the Masters segment. We're doing this because you now have to learn how to manage this. And it's not about getting to what? The exercise. It's understanding what pathology am I dealing with here? With that pathology, how am I best going to manage this? What type of surgery was done? Did you need to know exactly where those Harrington rods were?
I do.
Yeah, you do.
Absolutely.
Hey, I'm going to call the doctor. We're going to find out where these things are. Because the reason she couldn't lay down was because of what? The Harrington rods stopped at C what?
C7.
C7. Yeah. She couldn't lay down.
Yeah.
She never knew. Teacher, here, you got to put pillows under your head because you can't go into extension. You got some rods in there that are stopping you from doing anything. And the lifestyle management stuff you did with her, That was golden, wasn't it?
Yeah, it was. It was huge.
that was huge for her. And the reason why, the PT never got to that point because they did what? They cut them off. You now have a different realm that you're working in now. You've got to cross the T's and dot the I's with documentation. You've got to now make sure you assess that client and understand all the anatomy and pathology going on so I can produce a good exercise program that gives me a good what for the client?
Positive outcome.
An outcome. That's it. That's all the insurance carrier wants. Can this client go back to what they were doing before? You'll be their best friend.
Yeah.
Now, here's what we did in medicine and in physical therapy. Through the 70s, the 80s, and 90s, we made boatloads of money. We billed for everything. 36 visits, no problem.
Yeah.
Insurance company says, you know what? You ain't doing that no more. This is our money. So guess what we're going to do? We're going to establish caps. And with the caps now, we're going to say we're going to give you twice a week for 8 weeks, and then you're going to send us a report to see how well the client is doing. And that's what we're going to do. You send us a report, the client's making progress, we're going to give you more sessions. You don't send us the report, or the report shows you're not making much progress, we're going to do what?
Cut it off.
I'm going to cut you. Now, you guys are now knocking on that door. The thing that made physical therapy and chiropractic professions that everybody wants to get into was because of insurance reimbursement. You know what insurance reimbursement means? There is a revenue source out there. Client says, I got health insurance. Okay, fine. How many times you get clients that say, oh, it's Christmas time, I can't train with you anymore? Anybody?
Yeah.
Yeah.
Absolutely.
Clients say, you know, I can't afford you. Person has his health insurance card. I never heard that. Hey, here's my health insurance card. Okay, I'm gonna get some physical therapy. Sure, till the insurance carrier cuts you off. This is gonna change the way the profession grows. But you better be fair with them and you better be honest with them because they will be your worst nightmare. They will cut you off. So one of the things we need to be clear on is talking about next steps is make sure you know what your scope is. Your scope being, I'm providing exercise. I'm not mobilizing anybody. I'm not doing anything beyond exercise. And if you're a massage therapist, you're doing the exercise in conjunction with this. But I'm doing exercise. We're starting to see now more and more our fitness professionals. I talked to a young lady this morning. I got post-rehab patients. Now, you know what that conversation ended up like, right?
Oh, man.
You ain't got no patience.
Yes,
Excuse me.
Patience.
You ain't had no patience. And here's the reason why. And that's why I talk about next steps. When you say patient, you now elevate yourself to the medical professionals level. Now, I'm sorry. I'm not trying to be demeaning or anything, which means you know everything about that pathology. You can't say, well, I didn't know, because the therapist knew, the nurse knew, the doctor knew, and if they mess up, they get sued, don't they?
Exactly.
They get a malpractice suit. Mm-hmm. Shouldn't fitness professionals or medical exercise professionals get malpractice suits?
If you're claiming.
Yeah, you should. And when that rolls around, the first one, guess what everybody's going to suddenly start doing? Hey, Dr. Mike, I want to document what I did. Hey, Dr. Mike, I want to get those resources because I don't want to go down the path that I heard my buddy up in Baltimore went through because he just kept seeing a client and she wasn't getting any better, and finally something happened and it went wrong. So our next steps are we have to now start being a little bit more professional. We have to now cross the T's and dot the I's. We got to be real clear on our scope. We have to be real clear on what our colleagues say their scopes are too, because that reflects back on you, doesn't it?
Yeah.
You're in the gym and somebody's saying, hey, I got patience.
Patience for what?
Yeah, because it's going to cause some problems. We're going to start dealing with insurance carriers, and insurance carriers are going to start to say, why are you doing that? Give me a valid reason. You can't say, insurance carrier says, or you talk to the doctor. Let's be honest. How many of you talk to doctors on a regular basis? You don't talk to them. Why? They walk on water? No. They're just average people that went to medical school. I don't want the doctor to know what I don't know. Right or wrong?
Right.
I'm a little concerned about that. I don't want the doctor to know what I don't know. So I'm just not going to talk to your doctor, even though you got Harrington rods from C7 to down to L5. I don't want to talk to your doctor because could that make a difference in the care, in the service you provide? Not talking to that physician.
Not talking, yes.
Yeah,
Works
not
both
talking to
ways.
him. Yeah, it works both ways. Yeah. So in that scenario, you don't call the doctor, you don't get any information. Who suffers? The client does. Maybe there's some things that you don't do. So one of our next steps is we have to now start communicating with physicians, which means you got to spend a little bit more time studying the anatomy, the pathology, the protocols, the guidelines, the assessments, and less time worried about the what? Exercises. You guys know more exercise than I ever know. You guys just know them. And nothing else, you can make them up, can't you? Can't you make up an exercise?
If you know what the anatomy and pathology is.
Yeah, and the most important part of this is, and I think the missing piece in the fitness arena is kinesiology. Kinesiology is that was the first thing I asked Dr. Thrasher. We took that the first semester of PT school. That was the thing that washed everybody out. You didn't pass clinical kinesiology, you didn't move any farther. That's why you guys hear me sometimes, oh, Dr. Mike is gonna rail again about movement patterns. You know why? Because if you understand kinesiology, there are no human movement patterns. It's just human movement. And then you find the dysfunctional piece in the movement. Oh, she can't lift her arm. Your client can't lift their arms, or she has difficulty lifting her arms because her serratus doesn't work.
Yeah.
If her serratus doesn't work, her rhomboids don't work, do they? Nope. Her rhomboids don't work, her traps don't work. Her traps don't work, both upper and lower, right?
Right.
Soon as she walked in, remember the diagram we saw of her leaning to one side? That should have told you right then and there what? She's got trap dysfunction. She got upper quarter dysfunction because she's got a rod from C7 all the way down to L5. So the next steps now really evolve around, you've got to take more professional responsibility for making sure you are proficient in clinical anatomy and pathology, protocols, assessment guidelines, and these things. Because here's the deal, folks. If this client walks in your facility and they tell you they've got Harrington rods, and you don't do your due diligence, and eventually they're having more pain and more discomfort, who's liable for that?
Oh, that's us.
You are. And we play this game, I ain't gonna worry about it, I'm just gonna go ahead and see them. I'm gonna close with this. Your favorite aunt calls you. My favorite aunt is Aunt Alexine over in Lafayette, Louisiana. The woman is a hardcore New Orleans Saints fan. If you go over there on a Sunday and the Saints are on, she'll say, you going in there and make your own dinner, I'm gonna sit here and watch the game, okay? That's how hardcore, but we love her to death. Aunt Alexine calls me one day. I'm gonna see a trainer, I had a hip replacement. Okay, Aunt Alexine, great. Have the trainer call me. Trainer calls me. You ever worked with a total hip replacement before? No, but I'm gonna look it up. What did I call Aunt Alexine and tell her?
Don't work with him.
Don't work with him. Period. Let me ask you, would you go to a physician that had never done a hip replacement if you needed one?
No.
No, you wouldn't. There's no question there. But how many of you have seen clients you've never seen them before? I'm gonna figure this out. I'm gonna go look on the internet. Is that fair?
No.
Is that professional?
No.
No. Would you let a member do it? No.
No.
We have a long way to go in our profession, but we have the pedal to the metal. We're going faster and faster. There are groups out there that are saying we're gonna get you insurance reimbursement, get an NPI number, get all these other things. What would you think if me as a therapist going through PT school in my last year, not in my last semester, I'm getting an NPI number? What would you tell me? Mike, you need to finish school first before you worry about making this money. Right or wrong?
Right.
We got people getting NPI numbers. I don't have a problem with that. They're getting insurance reimbursement. Great. But can you produce the outcomes for clients? We've got a couple of groups out there now that are telling you to get NPI. We got some people that have gone through our AMES program and are going out here and they're getting these NPI numbers. Now, let me make sure everyone understands what an NPI number is. I have an NPI number from when I first started practicing back in the 1980s. The NPI number is a national provider identification. It says if you're any type of healthcare or medical professional, only licensed medical professionals could get them when I was going through years ago. You get an NPI number, great. But guess what the NPI number does? We're gonna track you the rest of your career. Yeah. Whenever you have a client that you work with and you bill for too many sessions, it's on your record. Whenever you have a client that doesn't get an outcome, it's on your record. Whenever you move from one facility to another, it's on your record. So these NPI numbers are great. They should, I think, medical exercise professionals should have them. Now that's reversing something I said some 15 years ago. You should have them, but make sure that you aren't you understand what it means. You've now made a deal with the next level. Yeah, I'm gonna get this money. It's gonna be great. We're gonna get the money. But when you don't provide the documentation, that's on your record, isn't it?
Yeah.
When your documentation is really jacked up, forgive me for using that term, that's on your record, isn't it?
Yeah.
Yeah. So the MPI number, Dr. Thrasher, I would say 10, 15 years ago, I was against it. You are going to get them now. Insurance reimbursement is coming, but make sure you don't simply say, oh, I just need this number to get paid. Make sure you understand the ramifications with that. I am getting a professional designation now. I got an MPI number. That MPI number is going to follow your professional conduct and your professional performance for the rest of your career. Make sure you're ready for this, because I think there are a couple groups out there telling you get these MPI numbers, we could bill insurance companies. If you can't document, you can't produce outcomes, you can't assess, you can't communicate with medical professionals, is this MPI number going to be a good thing for you?
No.
No. So please, please be careful of this. Who's that? Is that Orna?
It's me, it's Orna.
Hey, Orna.
Is that the same up here?
Yep, you guys have a different way of doing MPI numbers. They call them MPI numbers here, but your healthcare system, every provider has a number that tracks their performance. Every provider does. Okay, across the world, every provider has a number. It's based on each individual country. I'll give you another example. The codes for certain medical conditions are the same across the world. The World Health Organization develops those codes. Within each country, the coding set is a little bit different here in Canada than it is in North America, but it's the same process. What would the world be like if you're a doctor here in the United States and we have no way of checking what you're doing? That's chaos, isn't it?
Oh, yeah.
That's chaos. We have to have a uniform means of delivering service. That's why we push so hard for protocols and guidelines and criteria, because it has to be some guidelines out there, or anybody can see someone for anything, and Lord forbid, there's a lawsuit.
Yeah.
So I'm gonna close with this. You're called into court to defend the services you provided for a client after a car accident. Client was injured in a car accident, fractured their femur. They had a rod put into their femur. They then went to physical therapy for a period of time. Physical therapy paid for 8 weeks, or let's say 6 weeks of physical therapy, and then they came to you. You now work with the client. Somehow or another, you got hooked up with a lawyer. Lawyer said, hey, Justin, we'll pay you, but we're going to pay you after the case settles. What the client is going to do is pay you $40 a session. We're going to carry the rest on our books. When we get the settlement, we're going to pay you. Oh, okay. The insurance company decided not to settle. They want to go to court. Guy walks up to your office one day, knocks on your door, you open the door, you've been served. You got a subpoena. Subpoena says, we want all your records working with that client. Okay? You now got to go to court. You now have to, you take the oath, I swear to tell the truth, whole truth, nothing but the truth. They put you on the stand. Mr. Hibbert, I understand you saw my client, Darwin Ruiz. Is that correct?
Correct.
You saw him for spinal fusion that he had. Is that correct?
Correct.
Mr. Hibbert, how many of these have you worked with?
He's my first.
Your first one?
First one.
How long have you been doing training?
10 years.
10 years, okay. Mr. Hibbert, did you complete the full assessment on Mr. Ruiz?
I did not.
Okay, you know what? And I have a copy of the report right here, because we subpoenaed it from you. Seems like you didn't complete any range of motion, muscle testing, or anything of that nature. Why was that, Mr. Hibbert?
Like, I got nothing.
Okay, okay. Now, here's the deal. There are 12 people sitting over there in the jury box.
Yeah.
And these 12 people now are listening to you tell us you didn't do it. I see also here that you have a bill to the Acme Insurance Company for $150 for the assessment. Seems like they paid you on May 15th of 2022. Is that correct?
Correct.
And this is your assessment. Your Honor, I'd like to enter this document as exhibit number A in the case. We have a new and emerging profession. This thing is going to get bigger and bigger. It's going to get bigger than I ever imagined because the need is here. We've made some significant changes to healthcare. Particularly, we've cut back significantly on physical therapy and chiropractic care. And insurance carriers now are saying, okay, we're going to send some of these clients to you. The reason they're doing this, they think this is going to be a more cost-effective alternative. Yeah. But are these people still going to come to you with some of the ailments that they had leaving physical therapy early? Yes or no?
Yes.
And are they expecting you to produce outcomes? Yes or no?
Yep.
And with that, it requires professionalism, skills in assessment, exercise progression, all these other things. And you're looking to just get started with the what again?
Exercises.
But you got paid. And you're getting paid based on the standards they have for who?
You.
Us in the medical community.
Yeah.
The reason why Dr. Thrasher and I are so adamant about this, we know it's coming. And we know what it's going to be, what it was like for physical therapy. They're not going to give you any board and quarter. They're not going to say, oh, Justin, you're not a physical therapist. Fine, you don't have to provide a note. We're just going to pay you. Yeah. Wouldn't that be great? Not going to happen that way. They're going to say, hey, show us what you did. There's going to be a reviewer there. You know what the reviewer is probably going to be? Your worst nightmare. It'll be Dr. Thrasher.
I was going to say, it's going to be, what are you two?
Dr. Thrasher.
That would be horrible.
She's a reviewer, and I'm saying that fictitiously. It's Dr. Thrasher that's the reviewer. And she's saying, where's the paperwork, right? And she's meticulous. That's what you get in an insurance carrier, okay?
I probably feel no more disappointed in my life than having.
So, so we're trying to get you ready for the future. And I'm sorry to say this, there are a lot of folks out there that are now looking at this saying, we're going to exploit it. We're going to start getting you NPI numbers. We're going to let you start billing people's health savings accounts. And that's going to be a nightmare too. We've had it happen here in Houston. Client comes in, I got a health savings account. Can I use that to pay for my medical exercise training? Sure. 6 months later, the client breaks their ankle. They now need physical therapy. They need a specialized boot that their health savings account will pay for. It's exhausted because they paid who?
Us.
They paid you. Who's pissed off?
Them.
Clients pissed off. They're calling you. I want my money back. I need it. Because you didn't tell the client, you know, that money that you're bringing out is the money that you might use for something else. Let's be judicious about this rather than you got a $2,500 health savings account. We're going to use all of it. We're going to do 25 sessions at $100 a shot. They're going to want their money back, aren't they?
Yeah.
Yeah. And when you start billing the insurance company doesn't differentiate between chiropractic services, physical therapy services, and exercise services. If you get 36 visits of physical therapy with their insurance company, they don't differentiate between if it was chiropractic, medical exercise training, personal training, massage. It was only what? 36 visits for the year. That's it. So there's some things out there that are important that we need to know in these next steps. They're going to make a huge difference down the road for us, a huge difference. What I don't want to see is this. We play the insurance company because it's Big Brother. We can get paid. I provide them with the minimal level of documentation, communication, and I produce the minimal level of outcomes, but I'm still getting paid. You know what that ends up being? What we call capitation. The insurance carrier says, you want to play that game? I sign the checks. Insurance carrier says, you know what? For that client with that scoliosis, with the Harrington rods, you live in Houston, Darwin lives in San Francisco, Don Alley lives in DC. We're going to give you, each one of you, 8 visits. That's it. And instead of reimbursing you at $100, we're going to pay you $70. That's it. You know why? Because you didn't play fair with us. We now are going to set the standards. And when they set the standards, everything changes. Now, how many of you have clients that are employed? Most of you do, right? Sure. Clients have health insurance?
Yep.
Any clients ever ask you, can my health insurance pay for this?
Yep.
Yeah. 2 or 3 years from now, when you say, yeah, it will, you're now going to have to follow their guidelines, aren't you?
Yep.
Yeah. Get ready for it now. That's why we did the AMES program. That's why we're doing this MES Masters program. It's not, and notice, none of them are for true certifications. It's to get you ready. This is the same thing we do with medical residents, physical therapy residents, along the way to get you ready to go out and practice. You better make sure you understand how to cross the T's and dot the I's and manage this. Not just simply, I got some exercises. Oh, and I got an NPI number. We can bill your insurance company. Yeah. That is going to be the worst nightmare. You don't have patients, you have clients. You don't provide therapy, you provide exercise. And you're not any form of a therapist, because when you say that, you're now expected to know exactly what the medical professional knows. Be careful about those organizations telling you this stuff. Ask more detailed questions. We had a situation several years ago where an organization gave a certification that was a certification with the title therapist in it. Young lady contacted us. Hey, Dr. Mike, can I use this title? No, I wouldn't recommend you do. She did it anyway because the organization told her what? Sure. Yeah. She uses the title, gives her new business card with the title on it to a client who's also seeing a physical therapist. The physical therapist happens to be the state board president in that state. He takes it back to a board meeting. Guess who every board has? An investigator. Medical board has investigators, chiropractic board. They turn it over to the investigator. Investigator investigates. She ended up paying $8,000 in legal fees to remove what from the card? Therapist. Guess what the organization told her that she was got the certification from? We can't help you. Okay?
Well, they can keep putting that certification
out there. Be careful, be careful, be careful. These are the next steps, and make sure we do it right. Yes, ma'am.
As a massage therapist, I use the word therapist, but
now you're licensed by the state as a massage therapist. So for you, you're excluded from this with massage.
Right. So what I had clients that I had an NPI number because they would get in a car accident. They would go see a lawyer. The lawyer would send them to the chiropractor. The chiropractor would send them to us. But my reports had to be so detailed. Like I had to, if I worked on the cervical spine, I had to say how many minutes I worked on the cervical spine and what actual maneuvers or modalities I used on the cervical spine. If I worked on the thoracic spine, what did I use? How long did I work there? And it was tedious paperwork and I hated it. And a lot of times I never got paid because they were going through the lawyer and they only paid us after they settled. And a lot of times they didn't settle. And so I didn't get paid. Yeah. So it was not a good experience for me.
Right. So, those are the things that we need to make sure everybody understands. We had a young lady who contacted me a couple years ago. She had a client that was injured in a car accident. A nerve was severed, okay? Nerve was severed. Woman lost function in her hand. They went in and did some neurosurgery. She never got her hand function back. She went through months of physical therapy, almost a year. After a year, you're not going to get the return for the most part with nerve ruptures like that. So this lawyer talked this MES into seeing this client. So she calls me one day, Dr. Mike, I'm doing these exercises for a client with a severed nerve, and I just wanted to run them by you. So now, you know how that conversation went, don't you guys? That wasn't a real good conversation for her. And I asked her, I said, well, how long ago was the nerve severed? Because there is a period of time where we may get some back. Oh, it's been more than a year and a half. I said, well, how did you get this client? A lawyer? I said, this was a car accident? Yeah. I said, you need to abandon this right now because she's not going to get any more function. Oh, I got to send my reports in to the lawyer. He sends them to the insurance carrier. Have you gotten paid from the insurance carrier? Yeah. Until the PIP, the personal insurance plan that every insurance company has with every liability policy. When that runs out, it's called a PIP. You don't get paid anymore. She said, well, they stopped paying me about a month ago. Yeah, because the PIP ran out. And the lawyer is saying, we got to wait until the settlement comes because the PIP ran out. When they finally settled, we didn't win the case. I said, yeah, because the woman had a severed nerve and no exercise in the world was going to make it better. Yep. Okay? No exercise in the world was going to make it better. But the lawyer talked her into it. And why did she do it, folks? Because she wanted the what?
Money.
She wanted the money. Be careful. There are people out there now that are looking at things, and when someone starts talking about, we can build the insurance company before we talk about what kind of client it is, be very careful. So I wanted to finish this evening with these next steps. These become important. I am not a naysayer. I'm not trying to extinguish the flame. We need insurance reimbursement. It's going to become the way things go here in the next couple of years. But along the way, make sure you have the skills, the knowledge, the understanding, the communication skills, the documentation skills, and most importantly, the training skills to do this, and the ability to talk to doctors, therapists, and chiropractors. It's important, because what you don't want is widespread abuse of this, where eventually other medical organizations step in and file lawsuits that eventually preclude you from ever touching a client with a medical condition. And then you see a lot of this go back completely over to the medical side. I feel like there is a place for medical exercise professionals after the client has become stable, after they've been discharged from physical therapy, after physical therapy, chiropractic, massage have exhausted everything they can do, and the client can still benefit from an exercise program. That's where you come in. But the clients in the earlier stages, which we're starting to see now, some of these clients that we're starting to hear people working with are really far beyond the scope. And it concerns me, because all it's going to do is cause more problems for you. And a problem for you in Houston is going to be a problem for Candy in Sacramento, which is going to be a problem for Orner in Toronto, which is going to be a problem for Don in Washington. We have a profession, and everyone is paying attention along the way. I guarantee it. Anybody have any questions for Justin with regard to his client? Anything I can answer for you? Anybody? All righty. It is March 30th. I looked at that. I was like, man, the year's going by fast.
First quarter down.
First quarter's gone. So we're going to conclude this evening, but I want to conclude by saying this. Thank you, number one, for sticking with us this evening, and thank you for letting me talk about these next steps. But if you have a client that you feel you can benefit from presenting, the client may get some benefits, as in you learn more that you can share with your client from your colleagues, please consider presenting. Dr. Thrasher has been gracious enough. She works with each one of our presenters to make sure their presentations are great. Justin's was fantastic, to make sure you cross all the T's and dot all the I's and you got the paperwork right. Right?
Yeah.
And she does a fantastic job. I want to give her kudos for the great work that she does. But please, if you would, consider making a presentation. Okay? Please do. We need this to build our profession. Justin, have you gotten better? Justin said this earlier. You've gotten better at this, haven't you?
Oh, absolutely.
And you're getting better at it. Does it give you more skill and understanding out there working with your clients, too, to some degree?
Yeah, and the confidence to do it.
Okay.
Not questioning that.
So we want to see all of you have that ability, because at some point, as this profession grows, you're going to have to talk to a doctor. You're going to have to talk to a therapist. You're going to have to present a client to the insurance company, or you're going to have to call someone and say, hey, I got this client I'm really having a problem with. I'm not sure what to do. You can't do it by yourself. And I can tell you, in my 30-some years, I presented a lot of clients that I was having a problem with. I just had a blind spot. I missed something. And someone said, why don't you do this? Oh, I completely forgot about that. Let me try this. It doesn't say you don't know. It just simply says multiple brains are better than one. So with that, please consider it. Have a great remainder of the evening, and happy Easter is coming up. Not this weekend.
Next weekend.
Next weekend. Yep. So I don't think I'm going to see you guys before Easter. Happy Easter to anyone out there celebrating Easter. Be safe. Be healthy. Thank you for joining us. Please get into the MedX Pro community network and talk about situations that you've run into tonight that maybe you thought about. And also just get in there and communicate with each other. The community is for you. It's not for me and Dr. Thrasher. It's for you. We're old quacks now. We're done, okay? I'm looking at retiring next year. This community is for you to communicate with each other. Share your best thoughts, your ideas on what you're doing. So please, have a great remainder of the evening. Have a great remainder of the week. If I don't see you, happy Easter. We'll see you in 2 weeks. Take care, folks. Thank you again. Thank you, Justin, for a great presentation.
Thank you.
Appreciate it.